Welcome to Season 3 of GyrlSense. I'm Maria del Carmen, your host. Today, special guests are Nora Brugueras and Damaris Perez. Our topic today is breast health. Nora is an experienced event planner, a member of several civic affiliations. She's a philanthropist and an entrepreneur. Today, Nora is also the health system navigator of the Early Detection and Prevention Program at Hartford Hospital. Damaris is a Marine, has a love for cultural anthropology, and previously worked as an outreach educator. Today, Damaris is the Community Health Navigator for the Wise Woman Program at Hartford Hospital. Nora, Damaris, welcome to the GyrlSense family.
Thank you for having us.
Damaris, first and foremost, thank you for your service.
Thank you.
As a former Marine.
Thank you.
Both of you are colleagues of mine from a previous employer, and I'm so proud of you for continuing your excellent work that you do, specifically for a certain population that is close and near and dear to my heart. I too worked as a breast health outreach educator in the same program, so I can appreciate firsthand the level of work that entails behind the scenes and the amount of work involved in the community itself. So thank you again. Nora, why don't you tell us a little bit more about exactly what is the Early Detection Program and what services does it provide?
Sure. The Early Detection Program serves underinsured and underserved women as young as 21 through 64. So underserved meaning you may have insurance, but it may not cover preventive care, or may have a high deductible. We still are able to see women who have insurance, but if they have a high deductible, we can absolutely enroll them in the grant. So the services that we cover, we are screening for the early detection of breast and cervical cancer. While we can't prevent cancer, the early detection is the only key that we have now, right? So we can offer at no cost to our women a GYN consult, pap smear. That GYN consult includes a clinical breast exam, a pap smear, and a mammogram. And then any diagnostic follow-up, meaning if that mammogram or if that clinical breast exam comes back abnormal with further follow-up, then we can certainly cover that as well. Or the pap smear, for that matter.
And so when you mention that the program will pick up those fees for the underserved or the uninsured altogether, explain the free services. Because my experiences, I remember, paving that cement and trying to convince this particular community, which are my people, and to gain their trust that no, you won't be billed. It took lots of efforts. It took months before that first person or that first organization said yes to me, and that's when it kind of took off. So today, tell me or explain, first of all, where does the funding come from? So, and then, how are we working? How are we doing with the community these days?
That's right. I skipped through who funds us. The most important thing, right? Okay. The state. We get state funding, and we also get federal funding. So we run a very, very well organized program. So in addition to our funding, we also have core performances that we have to meet in order to be able to reassure that we are navigating the women, that we are educating the women, that we are making sure that these women are being followed. So not only are we just offering free services at no cost, we are ensuring that that patient's navigated through a system that, for the most part, is really difficult to navigate. And I think that's where the relationship and that engagement, that patient engagement comes in. You have to be willing to take time to engage with that patient, to get to know them, to see where they are in their, at life, hear them out, kind of build that trust, and reassure them that we are here for the sole purpose of getting their health in order. Because as women, we always put ourselves in the back burner. So not only do they not trust that it's not free, but they're not important. Where, I don't have time. I have to care for the kids. I have to care for the husband. I have to go to work because I have to provide for the children. So a lot of the time is just kind of just getting that relationship, developing a relationship with that patient.
So that the viewer can understand, when we say that it's free services, it's free to the client.
That's correct.
So the services are actually provided by the state, so it's free to the client themselves. So I think that was the key line that got them to kind of like, okay, you mean it's free for me, but it's not really free. Someone's paying for it.
Right,
of course.
It's just not the client.
Yes.
Okay.
Yes.
So having said that, how long has the program been?
Wow, the program at Harvard Hospital, I think we've had it since 1995, if I'm not mistaken. I mean, you were one of the pioneers, so thank you for developing a wonderful program for us, because it takes a lot of people to make our program work the way that it works.
And what that proves, the proof positive of the program, is that the funds continue, so the client isn't afraid to like, well, I'll go this year, but will they have money next year? You've been around since '95, so it's been consistent. So there's proof positive for the actual program that it's working, and that they won't be left out.
That's correct.
If I could interject.
Sure.
The word free has negative connotations sometimes, and so I appreciate all the work that you did, because sometimes they don't want us. They'll want us to say low cost or no cost, but it actually is a free service to the client.
Right.
Just because it's free, it doesn't mean that it's not a valuable service.
Exactly.
And it's up to us to make sure
that they're getting the same level of care,
quality,
professionally coordination, and just the medical aspect of it. That is nothing less than someone,
if anything more.
Exactly.
If anything, it's more.
If anything, it is more. So I remember that. So thank you for continuing. So, Damaris, what I remember about Wise Woman program, literally it was grocery shopping with these women, learning about reading the labels on the food items. And I also remember contracting, or the program contracting a professional chef. And we literally had back then, Emerald was really in style. So we did the BAM live dinner demonstrations. But it went so well.
Sounds like fun.
I was so well. It was over at the ERC building. I remember this. And it took off so that we had to book the chef several times after. So what can you tell us about the Wise Woman program? And I love the name then, and I still love it now. Wise Woman. Why didn't I think of that?
A lot of people think that that's the name of the early detection program, but because it just sounds so cool.
Absolutely.
Yeah. So if you recall, the Wise Woman program is the heart disease screening component. So we're screening for the early detection of breast cancer, cervical cancer, and heart disease, because they are, obviously the statistics show that heart disease is the #1 killer, more so than cancer even. So they have, people walking, women in our case, walking around with high blood pressure, diabetes, have no idea. They don't have insurance. They can't get screened. So with the early detection program, if they are in the breast and cervical program and they're age 30 and older, they can automatically be enrolled in the Wise Woman program. So it's funny that you say that about the food demonstrations and all of that, because we had changed it somewhat, or we didn't change it. The Centers for Disease Control changed it. So they were pushing more for health coaching.
Okay.
So what we do with the women now is when they come in, they get screened. You know, we check their blood pressure, we check their waist circumference, their BMI. You know, we do blood work to check their cholesterol and their sugar. And if the woman wants to set small, achievable goals, we can work with them. I work with them, but we're all trained, and we're all trained to do it. We can actually work with them to achieve these goals. So if they say, hey, I want to start walking, 3 times a week for 15 minutes, well, we can support them in that. Sure. And there's different stages. Now, behind the scenes, I love the idea of, doing the live food demonstrations, because what we were doing was we were doing group nutrition sessions with a Spanish-speaking dietitian. Primarily, our patients are Spanish-speaking. And at one of the last classes that we had, the women, they were so engaged and so involved that they wanted more. They're like, what's next? What are we going to do next? And we were like, well, this is it. Like, you graduated. You have a yoga mat. Yeah, you did really great. We can give you a nail file and whatever. Sure. So, but they were so engaged, and they were so eager, and they started throwing out suggestions. So they were like, well, they have YouTube videos, and, we can just come here to the same classroom, and then you can put the video. And then the nutritionist and I started talking, and she was like, I'm able to do food demonstrations.
Oh, good.
So it was just, everything just kind of fell into place. Yeah. So I'm actually working behind the scenes now to see if we can utilize the Bone and Joint Institute. They have a kitchen. Oh, beautiful kitchen. Small. Nice. It's a small space, but it's a beautiful, beautiful kitchen. And I'm working to see if we can have our first, in the new version of the Wise Woman program, if we can have our first food demonstration. There's another area within that same space where they can actually, depending on how many people, how many women are interested, there's another area while a group is doing the food demonstration, they could be taking a Zumba class. Nice. Okay. So to jump on Nora's, what I'm envisioning is a Wise Woman Wellness Day, but full.
Right, full on set.
Yeah.
Wonderful. So. And sticking with the food conversation, many of the clients then would often say to us, well, I would love to go to Whole Foods or whatever for much more healthier, quote unquote, healthier food products. But, my pocket takes me to such and such place where I can get pasta for $1, or rice, and
still the case.
Still the case.
Still the case.
So that's one factor. Right. Second factor is we're 3 Latinas here, okay? We know what our kitchens look like. Yep. We know what our pots. We know what we cook, right? Yes. So, and we know how we were brought up. Right. So. Based on how we were brought up and what we ate then, we may have had a little modifications, a lot more, knowledgeable of what we should and shouldn't be doing. But these women are coming in already full-grown adults, not really getting the information. So that's why the program is there. But what are we saying to them as far as what to shop for?
The good thing these days is that there are a lot more alternatives. So, to name names, it's not just Whole Foods that's in the organic business anymore.
Right.
I mean, Price Right, Aldi's. So you have a lot of the stores that they can get more bang for their buck. Okay. We have the, the farmers markets. They have so many more alternatives available now, and. You're right. The pasta, those are the go-to items because they're filling, they're cheap,
and they get more. The big. They can feed more.
They can feed more of the family.
Right.
But one of the things that we talk to them about, and the nutritionist talks to them about as well, is that no one's saying you can't eat your traditional food.
There you go.
No one is saying that you can't have the rice and beans or the tamales or the tortillas or whatever it is. It's just we maybe can enjoy it a little bit less,
right?
And maybe add a few more vegetables in the pot.
The word moderation was not in our vocabulary growing up.
No. Well, because
you everything. You had to eat everything.
You had to eat everything.
Clean the plate.
Absolutely everything. And in my case, I always went for seconds and made
right.
So we talk to them. We talk to them about. We talk about the cultural aspect of it because I could have a room full of women and I could have 10 women and they could be from 10 different countries.
Right.
And we all speak Spanish. We all speak the common language, but there's certain differences within our diet and everything. So we talk to them about, it is okay to serve a smaller plate. You don't have to clean your plate. Yeah. Because it's seen wasteful.
Right.
It's seen as wasteful. So.
Wonderful. All right. So let's switch on and let's talk a little bit more about the taboos, the myths, and mortality rates. So Nora, how are we doing with breaking cycles? I've attended many family funerals of my own, growing up, I was thinking back, I'm like, I never knew what the cause of death was, and many times it was the C word, but no one spoke about it because you don't speak about it, and then as an adult, when you would fill applications for something and they ask you, is there any cancer? Oh, gosh, I have the best family background. No, there's nothing in my family, right? Until you kind of connect the dots, after you're old enough. So what's your experience today with the population's openness to have that breast, not just cancer conversation, but even breast health conversation?
Well, I think, it's still there. The taboo, the stigma, because it's part of our, just different cultures, different religions. That's part of the barriers, right? The fear of even finding out. So that's still there. How do we address it? That patient engagement, that developing those relationships, that trust out there, community health workers like Damaris, going out there and meeting the patients where they are, in an environment where they feel safe. Regular conversation where I'm not wearing a white coat, I'm not a doctor, I'm not a clinician, I'm a person I'm a cancer survivor myself. I don't share that in general with our patients, but I know, I get it. I get the fear. I get the fear of going in to get checked or having the conversation. So I think that, personal connection is the key. That education piece is key. That support that we get from the state, from the CDC, and from our providers is key, because we can depend on them if we need to host a seminar, or if we need more of support to kind of have a patient sit down and explain the reason for, justification for them to come in.
One of the projects that I took on, because it was just such an eye-opener for me when I was, in the business, and I was like, wow, I would look at all the women in the program, like I saw like all my aunts, he's like, this is like my family, like all, and like, this is how my family thinks as well. So one of the things that I did was I actually was permanent fixture in the school system. So I would go to their health class, and I would be part of their health class, and I would speak for not just the girls in the class, but boys as well. And that was one way that I figured out to at least try to help to break the cycle, because we're, I'm skipping the adult, I'm going right to the kids. And that was a way of me handing out the information so they can bring home to their parents when was, the next screenings or whatever. having done that, I actually, one of the younger seniors at one of the high schools was detected with breast cancer.
Oh, wow.
Because I would go and do the self-breast exams. I would have, you know, it's going to be really funny, but I would walk around. Well, you know, right? I had my briefcase was full of breast models, right? Yeah. And so in the community, I was known as the breast lady for all the wrong reasons, or the right reasons, maybe. But you know, that was one way that I was able to reach, at least for the young adults, and try to help break that cycle. But it's amazing that even with all the information that there is today, and the openness in the televisions, and it's even in the telenovelas.
Yeah, the awareness and
so it's very much
cancer.
more open, but yet, you know, in the household, it's still such an issue or challenge, or so hard to kind of like open mouth and talk about it. So
I think it's cultural. You know, I had a patient this week actually that it's due for a biopsy, and her husband didn't want her to move forward with the and fear, not because he wants to be controlling. No. He's probably a very well, supportive husband, but I think it's just fear of not knowing. That's the knowledge. So what we've done is we scheduled a conversation with one of our providers so that they could get that information that they're looking for.
And having that one-on-one consult for those particulars that, you know, have that level of fear is a wonderful thing that the program provides. Damaris, we know that women don't typically experience the obvious heart attack symptoms, right? We don't get the chest pains. It just happens, and there was no clue beforehand. So what symptoms should women look for that may be tied to, that should bring them some sort of a awareness or trigger, like, is it just that, or can it be, or is it worse?
Right. So they may not experience the stereotypical, you know, left arm pain that they talk about. It could be a multitude of symptoms that could be attributed to other things, but when taken all together, nausea, a feeling of indigestion, dizziness, things that you could attribute to something else.
Right.
But if it's happening and it's intensifying, then if there's ever any doubt, we always encourage them to call 911.
Right. And then that's the irony, right? So a heart attack, nausea, like it doesn't compute. It doesn't compute, correct. It doesn't compute. So the more the reason to not take anything for granted, right?
Well, that's the importance of education, just like Nora was saying. Because a lot of people don't know that, a lot of women do not know that. So we have educational materials that we can provide them with that discuss those symptoms. Because even as a professional, I had no idea. Right. I was like, left arm pain, chest pain, clutching the chest, you know, Sanford style. And that was my understanding of what a heart attack was.
Right.
Or just understanding, too, your numbers, knowing your numbers. You know, Damaris has done a very nice job, and the state has done a very good job at providing us with the resources that explains in detail what those numbers are, what they mean, how they work, you know, so that they can go and talk to a provider. So that, you know, the objective is that, you know, they won't stay uninsured forever, right? If they get insurance, that they're able to know their numbers, where they are, that they could sit down and have that conversation. So, and ask the right questions, right? Most of the providers don't give you your numbers if you're okay. If you're right below, I mean, you could be a cookie away from high cholesterol. If you're a 199, you know, if you're 200, which is considered high, correct me if I'm wrong.
The limit is 200.
200. That's the limit. If you're 201, if you're 200, they're not going to tell you.
Right.
You're a cookie
A little
away
high.
from
They may say it's a little, but
it's a little high.
that-
but what does that mean?
But they may
in
not.
comparison to.
Right. I still don't know.
But they may
So,
not.
like,
Right.
When they tell me the numbers, what does that mean? Like, no, you're good. I'm like, okay.
Ask
And
for
I
the
have to
numbers.
have,
Ask for the
and I
numbers.
still should say, but
What does that mean?
What are the statistics? Should it be? So I always have
It's
to have that.
right. You're
But
within
it's-
your rights to ask for
Yeah.
because then you have a point of comparison because then the following year when you go and you
Right.
get checked, you're you know what, my cholesterol was this,
Yeah.
now it's this.
What does that
So
mean?
you can see, right.
What am I
Don't tell me
doing,
I'm
or
fine.
what am I doing wrong or
Right,
right?
yeah.
And that's exactly what patients when they come through our grant, and they're coming from an outside provider, because we have different providers outside the hospital.
Yeah.
They are shocked at the level of information, education, grateful, they appreciate, they're empowered, because they understand, they know that where they are, their status.
And you said a key word. It's empowering them to take control of their own health.
And they can advocate for themselves.
That's
Right?
exactly right. All right, so when it comes to breast cancer, a little statistics here. African Americans have the highest mortality rate, followed by whites, and then Hispanics. And this is like the $1 million question. Please help us understand why. Why is it that, the highest population of African Americans are the ones that actually die from breast cancer?
Well, I think it's because of the same conversation, the same reason what we're conversating, right? Those barriers.
Mm-hmm.
It could be culture, it could be religion, it could be access to health.
Mm-hmm.
It could be so many of those barriers that I think that's the reason why we're funded, why we exist,
Right.
because of the statistics, because of where we are in our community. We're funded because we understand that we're in a city where those barriers exist.
And barriers, specifically, you touched on it a little earlier. It's like the women, we think of us last, right? It's always the family first. And then, but isn't it true though that the minorities, specifically African Americans, the only reason, most likely, that they actually die from breast cancer is because by the time they find out, it's too late.
It's caught
Because the preventive care wasn't there. It's not that white Americans or the population doesn't get equal. It's just that when they do the regular early detection, and so when they, if it's detected early, then they catch it on time.
Right.
So really,
It's a vicious cycle. They don't get their early detection screening because of their fears, because of their, transportation, because of their children comes first, religious beliefs. It's because all these barriers, that's the reason why they don't get the early detection, the tests that they need, the preventive care that they need.
And compounding it with being underinsured.
Correct.
Even if they had the time, they didn't have the money.
And just navigating a health system is difficult, I mean, these days.
It is for
you think that we've gotten, to an area where we can make it easy, but I think that, that's the beauty of having navigators now. I think that's kind of where the health system's moving, and because they finally got it.
You're right.
It's hard to navigate a health system.
Very hard.
And these navigators now offer that service to the patients to be able to say, it's okay. We're going to bring you in, and we're going to navigate you through our health system.
Yeah.
And we were doing it. We just didn't have the word.
Correct.
We didn't know what the word was.
Hey, there you go.
Because you were doing it too.
Exactly. You were certainly doing it.
Absolutely.
Yes.
I remember for those that were actually diagnosed with breast cancer under the system, and then of our culture, I literally handheld them through the whole the actual system, because they're like, well, now what, So first and foremost, assuring them that the costs are still covered. And then, don't worry about that. So that was still part of our plan, the early detection plan. But I wanted to jump over you are a co-founder of the Women's Wellness Day at Hartford Hospital. So tell me a little bit more about that. And I know Damaris, I'm sure wherever Nora is, you are, wherever you are.
Yes, absolutely. So the mission or the vision as well for the is to bring our services out to the community. So when I first started with the grant, I started back in 2008. I've been a resident of Connecticut pretty much since I came into the United States from Columbia back in 1980. Never left Connecticut. When I started, I've never heard of the grant and the wonderful services that we were offering at the hospital, that we were offering for free. And my thought, while we were meeting our numbers and while we were getting referrals into the hospital, there was still, something in the air was telling me there were still women, there's still a lot of women that we were not capturing. And why is that? Why are we not capturing these women? So we work with the mobile bus. We knew of Malta House of Care. It's a mobile clinic as well. My thought was, why not go out and recruit women and really go out into the community and service these women that are afraid of, again, navigating a health system or just calling into the clinic because they're fearful of just having the conversation about breast and pap smears. They're just not comfortable with that information. Or, they just don't have the time.
So do you just pick a day for this? Or do you have several dates on the calendar for this? Or
well, we don't have it.
Year
We've had it maybe twice a year, if I'm not mistaken, I think roughly. We were in our 5th annual. It's coming up October 13th. It's going to be our 5th Wellness Day. And we have the Physicians for Women's Health, the doctors, Dr. Brennan and I collaborated our efforts. So she had an idea of Pap Smear Day. But she had no funding. She had the doctors, but there's no funding, right? So she spoke with the Department of Public Health. The Department of Public Health connected her to me. And my idea was brewing since 2009. So when she connected Dr. Brennan and I, we were ecstatic. I immediately was up and willing and ready. I said, you get me the doctors, I'll get you everything. I'll get you the mobile bus. So we were beyond ecstatic. What a wellness day is, it's just that. It's a day where you can go and have your GYN office visit all in one day, your mammogram all in one day, your blood work all in one day, the risk reduction all in one day, your education all in one day.
So is this where you pick a certain venue out in the community for it to take place, correct? Okay.
So we work with clinics at certain points, like we work with our women's health clinic, but it's on a Saturday. So typically our women's health clinic is not open. It's not accessible on a Saturday. So these women that are not able to get to an appointment throughout the week, now we're going to have an event in the clinic, all in one day. You'll be there 2 hours max. We'll be in, you'll be out, and we'll be there navigating you every step of the way. Sometimes we worked with Malta House again with, a mobile coach. So we can go anywhere in the community, as long as they have the permit. And we have the mobile bus. And we have Damaris, who's also mobile cardio check.
Yes, I have mobile medical equipment that I can actually bring to the community and do the blood work right there.
And that's what I remember. So we named it. It was just, they were health fairs. So, and the most successful venue that I always had was at churches. So church basement. So exactly that. We brought the hospital to them. And we literally their basements became a clinic.
Yeah.
Pretty much is
our
what
first
happened,
one was
right?
our first Wellness Day was in a
The church.
Right.
It was in a
Yeah.
church.
That's
Some Farmington Avenue.
Wonderful. So good to still know that is, still happening. But a little bit about you guys now, about you two. In perspective to the work that you do, how has working in this field been rewarding to both of you?
Well, that's a loaded question.
Right.
I think, you have a purpose in life, and I think that is I just happened to be at the right place at the right time when I was recruited, I guess, for the job. But then I was diagnosed with cancer, and I don't think I would have been the person or that I am or able to take in my diagnosis as well as I did. I get a lot of credit because of the way that I took my diagnosis and I became, I overcame it. But it's because of the work that I did. It has humbled me. It has educated me. It's not the end of the world. It's hard. It's a hard journey, but it's also, if you do what you have to do as far as the early detection piece, as far as the screening piece, it's so important to be able to know where you are. And just having that knowledge, I think that's the most rewarding too. And in addition to helping the women, empowering these women, empowers me, right?
Right. I was going to say, and who better than to have someone who, for the unfortunate group that are diagnosed with breast cancer or ovarian cancer, whatever it may be, when they look at you, when they used to look at me, all I could do is be there for them, have, the shoulder, but I've never walked in their shoes, right? So I had a limitation in how I helped them professionally and personally. I had limits. But what an inspiration, and who better else will understand what, because we could talk about it all day long, but if we've never walked the shoes. So who better else than to be in your position than yourself, giving a little bit back, it's a level of appreciation. So I thank you for that. And I'm sure that the women in the community thank you for that as well.
Right. Another piece of rewarding is to be able to help navigate our patients, right? I mean, I think it's just a wonderful program. One of the pieces that we didn't get into is that Medicaid piece. So if our patients are diagnosed with breast cancer, I am able to enroll them into Medicaid, fast track them if their legal status here in the U.S. is in order, then I am able to go in and fast track them to Medicaid, which gives them a full insurance immediately. For those patients that are on their status is not certain here in the U.S., they still get navigated through the system, through the hospital, but unfortunately they'll have to apply for other grants, but then it's also still an option. So I think that's too, it's also another rewarding piece of my job.
That's awesome. That is great, especially in today's climate.
I'm sorry.
No.
I was going to say, in my case, I was perfectly poised to be where I needed to be, because as a result of me being where I was able to help navigate one of the most important people in my life, my mom, who was diagnosed with not breast cancer, but she was diagnosed with cancer. And because of where I was, the connections that I'd made, what I'd learned, I was never one to question doctors or, ask for second opinions or any of that sort of thing. But because of what I learned,
Who you met.
Who I've met.
Right.
You know, Nora trained me. When I started, Nora trained me. And I always say she molded me in her tiny little image because she has she just has these amazing skills. And I really feel like it gave me a good foundation. So when Mommy got sick, we brought her over from Puerto Rico.
Yeah.
And when she got here, it was like, forget it. I was taking care because I knew what I was doing. And there was nobody that was going to tell me that I wasn't going to, you know, and I knew what her rights were. I knew the questions to ask. And so that was huge. That was huge. You know.
Incredible. What message do you have for women today as far as taking care of their bodies, whether it's taking care of breast health or just in general? You know, my platform is to service women. So what, you know, in your industry, in your profession and skills, like in the big picture, what message do you have for women? Because we don't think of us first.
Well, I think that for me, it would have to be self-care. You know, I've lost my son, and after that loss, it's a huge loss that you have no, you know, even though I've been through different journeys in my life, that has to be the hardest thing I've ever had to face. When I faced that, I had to sit back and reflect and create some self-awareness, right? And in that, I think that we don't do a lot of that reflection, of that self-care. You know, and you think, right? Because you get up, you go to your doctors, you're going and you take care of your kids. That's not self-care.
No.
You know, self-care is taking the time for you, taking the time to educate yourself, take the time to build yourself. That's so important, because in order for you to help anyone in your circle, you have to be prepared. And that's what you know, when I have that one-on-one conversation with my patients, that's what I tell them. That's how I'm, you know, it's that just that simple.
And you know, in many cases, the only reason why it's not thought of is because no one gave them the reason to, or told them that they can.
Permission?
Right.
Right.
No one's told them that they could.
I actually use the word, it's okay. It's okay to think of yourself for a moment.
Right.
You know, it's okay for you to take that time and go to the appointment, just like the mammography. To take the time.
Exactly.
You know, so I definitely second what Nora says. We put ourselves last.
Sure.
You know, we're taking care of everybody else. I don't have kids, but guess what? My patients, I feel sometimes like they're my babies. You know, I call them my ducklings because I just feel like I'm the mama duck, and I'm just kind of, but we have to give them permission and say, you know what, it's okay. Because if you don't take care of yourself, who's going to be there to take care of them?
Exactly. Well, ladies, the time has come, but we'll never say goodbye.
Absolutely not.
So hopefully, maybe one day we get to take life in action, right?
Oh, yes.
Right on scene at the clinic or wherever you are in the community, and maybe get some words in from the community. How about that?
That would be really exciting. Right. That would be really exciting.
So Nora, once again, just for recent, for an upcoming wellness day that you may have, October 13th.
Yes.
And where is this going to be held?
It's going to be a women's health clinic.
At the Women's Health Clinic?
Part of Harper Hospital, but it's 474 Hudson Street in Hartford, Connecticut. It's from 9 a.m. to 12.
Perfect. And for more information about the early detection program, visit GyrlSense.com, and I'll have all of the updated appointment line and so forth there. Thank you. Damaris, Nora, thank you once again for coming on the GyrlSense platform, and welcome to the family.
Absolutely. Thank you for having us.
I'm Maria del Carmen, your host. Visit GyrlSense.com for more information about our guest. Join us again for more GyrlSense.